The MFR Naloxone program is designed to be administered to patients in respiratory arrest post-opioid overdose. Naloxone is to be used only if you are unable to ventilate the patient adequately with a bag valve mask and oropharyngeal or nasopharyngeal airway. Remember, if the patient is in cardiac arrest, administer CPR and AED immediately. Naloxone is not to be used for a patient in cardiac arrest. Patient assessment must be completed and documented on the patient care report. This includes blood pressure, heart rate, respirations, breathing quality, general appearance, and the age of the patient. Signs and symptoms of an opioid overdose are not limited to, but they may include respiratory depression or respiratory arrest, drowsiness, an altered level of consciousness, unconsciousness, pinpointed pupils, bradycardia, or hypotension. Inside of each naloxone kit, you will find the following: 2 ampule breakers, along with 2 ampules of naloxone, 2 nasal atomizers, 2 3 ml syringes, and 2 red-capped blunt fill needles. While wearing gloves, responders will prepare the naloxone nasal spray in the following manner. Open the naloxone kit and place a red blunt fill needle on a 3 cc syringe. Please note, the ampule of naloxone has a white dot on one side. Keep the side facing towards you as you insert it into the ampule breaker. Snap the top of the ampule off with the white dot facing you while pushing the top of the breaker away from you. Remove the red cap from the blunt fill needle. Now place a needle inside the ampule on an angle until it reaches the bottom. Slowly draw all of the medication into the syringe and replace the red cap back on the blunt fill needle. Unscrew the blunt fill needle and replace it with the nasal atomizer. The medication is now ready for administration. Lay the patient on their back if possible, and gently insert the tip of the nozzle into a nostril until either side of the nozzle is against the bottom of the patient's nose. When administering the medication, push a syringe for 1 to 2 seconds to ensure there is a proper mist. Each dose contains 0.4 milligrams naloxone hydrochloride in 1 milliliter nasal spray. 1 entire spray in one nostril is 1 dose. After administration, place a used ampule, syringe, atomizer, and blunt fill needle in the sharp shuttle and give to paramedics for proper disposal. The naloxone kit provided to MFR agencies contains enough equipment to deliver a second dose of naloxone. A second dose can be administered if the patient does not begin to breathe within the first 3 to 5 minutes. Remember, ventilations and airway management is the most important part of resuscitation efforts. A second dose of naloxone is delivered in the same manner as previously described, except administered in the other nostril. It is also important to be aware that naloxone wears off after 30 to 90 minutes and the overdose can return. If the patient responds to naloxone but relapses back into respiratory arrest before paramedics arrive, a second dose should be administered. Again, the second dose of naloxone is delivered in the same manner as previously described for the initial dose, except administered in the other nostril. Be prepared to manage patient behavior following the overdose reversal, such as confusion, irritability, an attempt to leave, and desire to seek more opiates to relieve the withdrawal symptoms. If the patient starts breathing again and it is safe to do so, position the patient in the recovery position Administer oxygen via non-rebreather mask. Encourage the patient to accept medical care if they are resisting medical assistance. Naloxone can also cause the patient to go into acute withdrawal. Common signs of withdrawal can include, but not limited to, vomiting, agitation, weakness, sweating, and shivering. All healthcare providers who have direct patient contact must wear proper PPE. Ensure that there is an escape path between the provider and patient. Exit the area and contact EHS if the patient or any person on scene becomes aggressive or violent. If a white powdered substance of unknown origin is found, treat as a hazardous materials incident and exit the scene. Contact the EHS Medical Communications Center. Caution is to be used when breaking off the top of the naloxone ampule, as sharp edges may exist. Again, it's important to ensure that blunt fill needles, syringes, and ampules are placed in the sharp shuttle and given to the paramedic crew for proper disposal. The MFR agency shall document the following in the notes section of the PCR: signs and symptoms of the patient, attempts made to ventilate the patient using basic airway procedures, the time naloxone was administered to the patient, the patient's response to naloxone. The PCR shall be sent to MFR services within 7 days of the incident for review. Naloxone kits must be kept in the EHS-supplied containers with the following criteria. It shall be kept between 15 and 30 degrees Celsius and kept in the provided case until ready for use. It shall be taken out of service if frozen. It shall be checked on a monthly basis for expiry and damage. If damaged, a request for missing or damaged equipment report will be filed with EHS MFR services, and the damaged or expired contents will be replaced. Please note, if naloxone is administered prior to paramedic arrival, the MFR agency must update the Medical Communications Center. The report shall note that naloxone was administered and the patient's status post-administration. The MFR shall monitor and record vital signs once every 5 minutes until the arrival of paramedics. At the time of arrival, MFRs shall give a detailed report, ensuring the paramedics are aware that naloxone was administered and the time of administration.